My name's Mel, and I've been a registered nurse for 25 years.
And my name's Sue. I have been a registered nurse since about 2007.
Our workplace might look a bit different to other people's workplaces because we're one DWG, the Cancer and Wellness Centre, but there's two HSRs. Sue is a HSR for a renal dialysis unit, and I'm the HSR for medical day oncology unit. So we work together and complement each other.
Yeah, we share the role.
When we moved to our new centre, we bought trolleys that we thought were appropriate and would be really good for workflow. When we started to use them, we realised that once we loaded them, they were 76 kilos. And staff started to notice it was repetitive, it was a strain.
It's those long-term risks to musculoskeletal injuries to nurses, which I think stands at about 77% at the moment.
So us as HSRs have done a risk assessment, involved our management and identified that it was a risk, and then what strategies and things that we can look at to replace that risk and keep our staff safe. It took us 2 years, but we have now had our trolleys replaced. So our trolleys now weigh 30 kilos instead of 76 kilos. So they manoeuvre very easily. There's no strain on your body. It's totally different. It's changed all of our workflow, and staff are now happy with the change.
We were challenging the status quo. Things had been done a certain way for a long time, so certain tasks were looked at as having an acceptable risk, and people didn't see that there was a problem.
Including some of our colleagues. So it was even discussing with your own colleagues about, do you understand the risk?
We had monthly meetings. Every member of the DWG had a chance to be involved. We got the head physiotherapist in. We had engineering come in.
The OH&S manager, we had exec involved, we had director of nursing involved. We even contacted hospitals in Melbourne to see what type of trolleys and things that they were using.
Everyone got to have their say.
I think the key was not giving up and keep going.
The hurdles that they went through to get these new trolleys definitely makes us all feel well represented. They're approachable, they're always checking in to see, is there anything you can add, is there anything we can change?
Just the willingness to put themselves out there, to work through the process and take that on as a portfolio. They absolutely deserve that recognition.
I love having the two girls there. They have been so proactive in the last 2 years as far as risk assessment, finding issues. They're strong enough to take on the banter that goes with consultation. It was so easy for me as a manager to know that they were just doing it.
If there was some advice that we could give other HSRs, it would be to work as a team. We get to work with a really dynamic group of people, not just at a DWG level, but at a management level as well.
And don't be afraid to ask for advice or help, and don't give up.
And don't give up.